How soon can you have the implants removed and replaced with bigger ones after your first breast surgery? Which ties in with my third question, question number 3, having very large breast implants. So Ruth, you're a legend for answering me a question. Thank you very much for that, and I shall endeavour to answer that. Bit of a worry question, that one, Ruth. How soon can you have the implants removed? There's a few issues going on there. So from a purely surgical point of view, when you do surgery, there's obviously a lot of scar tissue, and you want to wait for that scar tissue to settle before you do another operation. Ideally, now, if you need another operation, if you have a hematoma or have an infection or something, you can do surgery at any time. You can do surgery next day, next week after an operation. You can do surgery at any time. But if you're doing an elective operation, so if you're planning the next surgery for the best time, from a purely surgical point of view, at least 3 months. 3 months minimum, ideally a year. So I guess any time between those two, in terms of scar tissue settling and softening and the surgery being easier. Surgery is very difficult if you go in soon. It's all scarred and hard, and the surgery is not very nice to do, and everything's quite woody, and tissues don't give so much, particularly if you're going for bigger implants. So probably 6 to 12 months, I would say, would be the sort of time that would be the minimum from a surgical point of view. The next point I would make is that I wouldn't make any rash decisions. Sometimes people, when they first have surgery, I don't know if you've just had surgery, I don't know what your situation is, Ruth, I don't know how long after surgery you are or whatever, but if you haven't long had surgery, then I would say to you, does this look sort of, if I do it up, would it look weird? Yeah, that would look weird. Then I would say to you, if you haven't, live with them for a while. When people have implants, they often think, oh, they're too big, they're too small, they're not right, too high, too low, too wide, too close together. So there's all sorts of issues and things that you go through when you first have surgery. I would say live with them for a while, for as long as you possibly can. You want to minimize the amount of operations you have to your breast. So, I would just be absolutely sure if that's what you want, because again, I don't know what the process was you went through for choosing the implants, but if you've gone through the process, if you've chosen the implants for a reason, I always think that you've chosen those implants for a reason. You've hopefully got the dimensions right, got it all nailed down, so it's just the right dimensions, the right width, the right profile. So then you go changing them. Now, I understand you say you want to be big. A lot of people say they want to be bigger, but you've got to be a bit careful that you don't go for maybe a higher profile implant that looks different and doesn't look quite so good, or you go for a wider implant that maybe gives you some problems with being too wide for your frame. So you can have issues when you change implants purely based on size, because it won't just be the size that'll change, it'll be the shape that'll change as well. In some way they'll either go wider or they'll go fuller. So you might be happy with that, you might want them wider or fuller, but in which case fine. But it's something to think about. If you have got implants, I would say you leave it as long as possible, just for the sort of psychological things to sort of sink in, and to be sure that that's what you really want, because you really need to try and minimize your operations you have to your breast.